I have a special guest this morning in Dr. Shad Costley, board-certified family physician with more than 20 years of clinical practice experience as a primary care practitioner. Now, he's here to share with us on the show today head-to-toe tips to keep your family safe this fall and winter. We know what's going on around us. Welcome, Doctor. How are you doing?
I'm doing well. Thanks for having me. I appreciate the opportunity.
Okay, well, we are living in unprecedented times where everyone's health and safety are being put to the test. And as we enter fall and winter season, kids are heading back to school. Many of us are back to work in the office, and we're starting to travel again a little. So keeping your family protected is more important than ever. Now, Dr. Costley, as a family physician, father, and President, CEO of Blue Willow Biologics, we're going to look at some recommendations firstly. Now, the big thing is touching the face, correct?
Well, it's one big thing for sure. You know, we deliver a lot of germs to our face with our hands, obviously. So hand hygiene is certainly important. We want to wash our hands and wash them well. There's great videos to show your listeners how to do that really well, and it's a little humbling when you see those, how few of us probably do it right.
Mm-hmm.
Hand sanitizers can help when we can't wash our hands. We've launched a product called NanoBioProtect, which introduces kind of a new concept, which is nasal antiseptics. And that is, you know, the intuition here is if your hands have germs on them, you don't get sick because the germs are on your hands. You get sick because those germs get delivered, as you point out, to your face when you touch it. And no matter how hard we're going to try to not touch our face, it's going to happen.
Yeah.
Probably happens 20, 25 times an hour, unconsciously or subconsciously, I guess. You know, just it's hard to avoid.
That's
it happens
what
when we sleep. There's just no way to fully avoid it. So having that next level of protection, you know, both keeping your hands clean and then also having a nasal antiseptic on board if that contaminated hand does touch your face, I think is critically important.
Yeah, right. And really, I was just going to ask you, how do they figure out roughly, 23 times an hour that we do that?
It was an observational study done by a journal that focuses in prevention, and they basically just watched people in their normal routine daily lives, and people who weren't, who sort of agreed to be watched, I guess, to a point, but probably weren't aware of what they were being watched for.
Mm-hmm.
And we just touch our face all the time. We do it when we're thinking. We kind of, scratch our cheek. And most importantly, we touch our nose with the predominance of those touches.
Right.
It's not just that we're touching our chin. It's that we're really reaching up to itch our nose, scratch our nose, rub our nose. Masks make noses itch. Masks are critical. They save lives. We know this. We need to be using them. But they do make your nose itch. So there's a temptation kind of to adjust your mask. And we've all experienced that in the last few months.
Right.
So we think having a nasal antiseptic on board, like NanoBioProtect or another one, is really a critical piece of having another layer of protection when the inevitable happens. Hand hygiene isn't going to be perfect. Trying to not touch your face isn't going to be perfect. It's going to happen. Layers of protection, flu shot, masks, social distancing, all those things that we know.
All those things, yeah. And we're going to get right into this NanoBio product. It sounds absolutely amazing. 99.99% kill of infection. And that is something that you're going to share with us, which is pretty amazing. And I would recommend our listeners have a good listen to that because you might want to go get this stuff. But washing your hands is one thing. Most people wash their hands for a few seconds. We know that. Just enough to essentially wash off the soap that they put on. But it's important to wash your hands for at least 20 seconds and up around the wrists as well, apparently. What about fingernails? What do you think on those?
Yeah, you want to get underneath. You want to get underneath them as best you can. Use one fingernail with that soap and water to get underneath the fingernail neck, on the other hand. So again, just to your point, you want to be doing this for a decently long time. Some people say to go ahead and sing happy birthday to yourself, even if it's not your birthday, while you're washing your hands. That'll give you a pretty good clue that you've been washing them for long enough.
Right.
But you're right. If you're just squirting soap on your hands and using the water to get rid of the soap,
right?
Is it better than nothing? Probably. Is it good enough? No. So yeah, I think hand hygiene is critically important. But again, back to it, only because you touch your face. So putting a layer of protection on your nose, like a nasal antiseptic, just makes a lot of sense as another layer.
Right. And of course, protect yourself and your family from head to toe. Get that annual flu shot, right? Flu vaccines do save lives and are a critical part of any family's plan for staying healthy. But you recommend that, right, Doc?
Of course. Yeah, it's just such a critical piece. Flu shots have been safe and effective for so many years. And I know in previous years there's been some skepticism out there about them. But if one good thing can come out of this awful pandemic, it might be that we would all recognize that, as you say, flu shots save lives. And just really important. Reach out to your doctor, find them at your local pharmacy. Mm-hmm. They're widely available, they're safe, and they're just a really critical thing that we all do this winter
we often
to stay healthy and safe.
We talk about the mask in public places, social distancing guidelines and so on. But this new product now that you have, that it's called what? NanoBio Protect. Is that correct?
That's correct. It's NanoBio Protect.
And it's the
only antiseptic.
It's an antiseptic.
Use it along with your mask.
Right. It's the only alcohol-free, moisturizing nasal antiseptic, right? So, okay, tell us all about it.
Yeah, it's a very innovative product based upon lots of science that we've been researching for many years as a small vaccine development company, actually, that now sells nasal antiseptics. We've taken a common skin antiseptic, attached it to what we call nanodroplets. Don't need to get into the details of that right here, but nanodroplets are a patented approach to delivering that skin antiseptic. Persists on the skin for up to 8 hours. As you mentioned, it's moisturizing, so it goes on very easily. Doesn't have any alcohol vapors. It's alcohol-free. This isn't putting hand sanitizer up your nose. That's not what we're promoting here. This is a very specific skin antiseptic that's specifically designed for that skin that's most critical to preventing respiratory infections, and that's the skin in and around your nose. So if your listeners are really interested in science, they can go to nextlevelprotection.net. So nextlevelprotection.net, we take a deep dive on the science, and you can learn more about it there. But yeah.
Okay. Well, that's a darn good thing to be able to do, is go to a site, read all about it, and, for laymen like us, try and understand the whole gestalt of the thing. But, to lay people in a nutshell, I'm trying to visualize, is it like a cream, or is it, what do I put it on, and where do I pat it around the nose?
Yeah, it's thinner than that. It comes in a bottle, and you take a standard cotton swab, insert it into the bottle, you moisten that swab, wipe it in and around the skin of the nose, maybe about a half an inch up, about the level that a standard cotton swab, the tip of it would disappear. And it dries clear, so it'll be white when it comes out of the bottle, goes on and quickly dries clear. Very easy to apply, moisturizes. If you've got an irritated nose, don't worry about it. It's probably going to it is going to moisturize it, make it feel even better. So we often get that question, if I've got sensitive skin, or if I've got an irritated skin, if I've got a crack in my skin, that alcohol products might sting or irritate. Is this a problem with this? And it absolutely isn't. So
yes, they do.
Really, really easy to understand. Doesn't have a fragrance, doesn't have a vapor. People experience it as being almost pleasant, or not just almost, but pleasant to use.
Sounds amazing. And you've called it nano droplets.
Yeah, nano droplets are kind of our patented technology underneath it. They are tiny little natural plant droplets that are very tiny, nanoscale tiny, and we attach the antiseptic to them. Those nano droplets persist on the skin, which gives the antiseptic long-lasting effectiveness. And they are also moisturizing because they're oil-based, so they're not irritating to the skin the way an alcohol product would be.
Right.
So that's really the special technology here that takes a commonly available skin antiseptic but delivers it in a very special way, and therefore provides the user of it with long-lasting protection that's also pleasant.
Is there a, shall we say, a duration period, Doctor, that it will go for at full strength before one needs to reapply?
Yeah, it provides up to 8 hours of protection in testing. So the way I use it and my family uses it, we apply it in the morning before we go about our day. And then maybe later in the day, if I'm in a setting where I might have a lot of exposure, whether it be to patients or I have to be a place where social distancing is difficult, I'll apply it again midday, even though that's shorter than the 8 hours. And then I typically apply it sort of in the late afternoon or the early evening. So it gives you long enough protection that it's not interfering with your day's routine. If you've got to go to work, put it on before work. You don't have to have it with you all day. If you've got a child who's going off to school, it'd be a nice regimen before they go off to school in the morning, and know that they've added another layer of protection throughout their school day. So we formulated it to last long enough that it doesn't have to be carried with you and applied throughout the day, making things inconvenient.
Yeah, that's a good thing. That's a smart thing to do there. What about, the connection with the mask? I mean, it's only half an inch up the nose, as you say. Then you could sort of go around inside on the nose. Anything outside or at the bottom of the nose at all?
Yeah, I apply it inside the nose and then sort of the rim and the skin around the nose, the part that you might naturally touch with your finger, right? That sort of the sort of entry point to the nose. Yeah, sure. And we see it going on underneath a mask. You know, masks are predominantly worn to protect others. We should all be doing it because we're all in this pandemic together. The primary purpose of a mask is to protect someone from you if you have a respiratory illness and you may not even know it, or you may be symptomatic. This is a layer of protection for you. So I think the two go hand in hand, and you should do both, right? Put this on in the morning, use it throughout the day,
right.
But also we really are, you know, we know the data on masks. They save lives, so we certainly want people to use them in addition to NanoBioProtect. All
right. Now, Doctor, this can be bought today, right? This can be purchased?
It can. It's available over the counter. It's for sale on Amazon. NanoBioProtect, or nasal antiseptic, are your search words there. And it's going to be available widely at CVS stores this fall. It's not quite there yet, but that's coming in the next few weeks. So it's going to be widely available throughout the United States. And again, nextlevelprotection.net if people want to learn more.
Well, that's terrific. And it's on Amazon now, of all places, but early before we're getting right into winter. Nextlevelprotection.net. That's the name of the website, folks, that I recommend you study. Have a read, okay? This is an amazing product. Give it a shot. I'm going to. I can tell you now. It's like another protection, just another shield. But what a good one. Good luck with this, Doc. It's obviously a lot of work and thought has gone into it.
It has. Our scientists have worked hard at it, so we appreciate the chance to talk to you today about all the ways that your viewers can stay safe this winter.
Thanks
for your time. I really appreciate it.
Well, we appreciate you. Thank you for that, Dr. Chad Costley, board-certified family physician. In fact, he founded and led the Ponce Primary Care. It was a leading medical practice in Atlanta, Georgia. And in fact, he's been named one of Atlanta's top doctors for the past 3 years by the Atlanta magazine, and a Bachelor of Arts and so on, Doctor of Medicine. So he knows his stuff. And this is a clever product. So go to it, nextlevelprotection.net, okay? And have a good read of it. And it's on Amazon right now, should you want to get it. So we'll be back with another Mark Bishop Show shortly.